what are you seeing in your practice? Somebody comes in and maybe they've been fighting with the traditional system, getting nowhere, have an issue that's been going on for a long time. Like these musculoskeletal issues are some of the most common reasons that people need to see a provider. And yet perhaps are some of the ones that you tell me kind of linger and aren't treated perhaps as they should be. What are you seeing in your practice?
Yeah, so over 50% of all reasons why a patient will see a healthcare provider is because of pain, particularly musculoskeletal pain. Mm-hmm. And so it's the
So they're going to their primary care doc saying, I've got a pain in my knee.
My neck hurts, my shoulder hurts, my back hurts.
Okay.
It's keeping me from doing X.
Yes.
Okay. And primary care, you really have to think of them as the quarterback. They are the ones who are reading the field to help direct the play, but it's very reactive. And how do I help navigate this problem that you have? And they have so much diagnostic and management work that they have to do that there's just no meaningful way that they can develop the specialties to manage these musculoskeletal injuries personally. It's just not what they do. They don't have the advanced orthopedic training and intervention to also determine what kind of problem this likely is and how to best manage that.
So you're saying like a lot of these problems that people are going in with, like there shouldn't even be an expectation that that's who's going to fix the issue.
Yeah, the primary care provider will never be the person that's going to fix your sciatica personally with their hands.
And yet, anecdotally, as a nurse, for a long time, I'd hear that complaint. I've been seeing my doctor for this, this issue for a long time. It's still not better.
Right. And so, if I'm working with my PCP and we're going through all these imaging, like those systems are not efficient. You have to have the appointment. Let's say you're having sciatic pain with running, for example. Okay, well, let's do a screening X-ray to see what's happening. You got to schedule that appointment. It's going to take a week or two. You're still hurting. You're not able to train. You come back. The imaging's negative. Well, let's send you to physical therapy. And then the physical therapists hopefully are going to be able to address the issue and take you there and move things forward. When that works, it's great. It works really well. But let's say this is a simple peripheral entrapment, like a carpal tunnel syndrome. The advanced soft tissue diagnostic work, it's much less common than you might think it is that providers have this training to be able to suss out exactly where the problem's coming from and then recognizing, is this an intervention that's going to do best with myofascial work either by a chiropractor or physical therapist? Is this something that's truly spine related? Is this something that, based on your other factors, is more likely to be something that we might need to pull pain management in? And then actually being able to present, this is your problem, this is the most likely solution. If you don't respond to this, then this is plan B. And if you don't respond to this, then we need to go to plan C. And between B and C is when we want the MRI. Because I need that diagnostic resolution to determine if that's truly what the issue is. And so the going back to our clinical decision making, whenever you order a test, you have to be able to say it's going to verify what you're doing, or you're at a fork in the road and the test is going to tell you which way you need to go.
Sure.
And if the test isn't going to change what you're doing right now, then why are you doing it?
Then why are you doing the test?
Right.
Yeah.
And so having patients understand that roadmap is not just confidence inspiring, but it lets them know they have a plan.